Chapter 6, the muscular system. The noun is muscle, muscle, and the adjective is muscular. Muscular. Always work on the previous section because it gives you an overview of what we are going to teach, and it also contains some questions which can be useful for the exam. Let's get to the first question. The neuromuscular junction is between a muscle and a neuron. Well, from here, neuro, we can easily understand that the answer is neuron. Question 2. In the muscular system, the opposite of the origin is the insertion. Insertion. Here we have two terms, origin and insertion. Origin is the attachment site of a muscle that remains relatively stable and does not move during muscle contraction. Insertion is the point where the muscle attaches to a bone that moves during contraction. Question 3. The quadriceps femoris muscle forms the anterior part of the thigh. The upper part of the leg is the thigh. The lower part is called the shin. Question 4. The opposite of flexion. Flexion is extension. Extension. A synonym for flexion can be bend. Bend, the opposite was extension. Question 5. The opposite of abduction is adduction. Adduction. Here we have the word ab, and here we have the prefix ab and the prefix ad. I tell you the difference. When you have the word ab, it means away, and when you have the word ad, it means toward. So moving away, moving towards. Question 6. The band of connective tissue that attaches a muscle to a bone is called a tendon. I think this was quite easy. Question 7. Polymyostasis is the inflammation of many muscles. You're familiar with the word poly means many, polymyositis, myo means muscles, and this itis or itis is called the inflammation. So polymyositis, inflammation of many muscles. Let's get to question 8. The word kinesis. Kinesis means movement. And here we have the word kinetics. Kinetics, which is the scientific study of forces on things that are moving. Good. Now let's get to the case study on page 189. I read the first paragraph for you. Thomas, a 16-year-old high school student, had a severe lacrosse accident that resulted in a flayed arm. Lacrosse is a kind of tool used for sports. He had sustained right brachial plexus injury and had no recovery. Brachial means related to the arm. He has continued to take medication for neurologic pain. He was scheduled to see his orthopedic surgeon for a possible brachial plexus exploration. For plexus, you can say network, and for brachial, you can say related to the arm. The word flail arm, here you can see it, refers to a medical condition where the arm becomes completely non-functional due to severe nerve damage. Okay, please read the rest of the passage. Here I work on the most important vocabulary and pronunciation. Let's get to the first one here. Atrophy. Atrophy. Atrophy can here in medical terms can be used as a verb or as a noun. In combination, you can see that in muscle atrophy, as a verb, atrophy means to be reduced in size and therefore strength, or more generally to become weaker. So atrophy, become weaker. This is a good definition or synonym for that. Here we have two good words for pronunciation: supraspinatus. Supraspinatus, which is a key muscle, shoulder muscle, I'm sorry. And here you have infraspinatus. Infraspinatus. Here we have the word subluxation. Subluxation, which is a partial dislocation. Deltoid atrophy. Deltoid atrophy. You're familiar with the word atrophy. Here you have deltoid. For example, in the deltoid muscle, we mean the deltoid muscle is a prominent triangular muscle located on the outer shoulder. That is why we call it deltoid. It means triangular. The word ROM here means range of motion. Range of motion related to movement. Okay, intact sensation and palpable distal ulcers. Palpable means perceptible, means detectable, if I want to give you some synonyms. And distal means away, situated away. Remember to check the word file later. Here, distal, situated away from the center of the body. Here we have the word subscapular, which is the adjective, and subscapularis, which is one of the main shoulder muscles. And you're already familiar with the word sub. Sub means under, as in the word subway. Subway means under the way, or we call it metro as well. And a good one here, serratus. Serratus. Serratus is one of the three muscles of the main part of the body. And we call it serratus because it is shaped like a saw. Shaped like a saw. You should be familiar with the word pectoral. Pectoral related to chest or breast. This EMG here stands for electromyography. Electromyography. Another word here, somatosensory. Somatosensory. Somatosensory system is a critical component of the sensory nervous system. The word sensory refers to the sense, and somat refers to the body. It is a Greek word. I think we have already worked on it. His diaphragm was examined under fluoroscopy to rule out. This RO stands for rule out phrenic nerve injury. We say rule out because we want to decide something is not possible. And here we have the word phrenic. Phrenic. Phrenic means relating to the diaphragm. Diaphragm. Remember, this G here is not pronounced diaphragm. Here we have another good word, sural. Sural nerve graft. The word sural means of or related to the calf or the back part of the leg below the knee. And here we have the word graft. Let's work more on the word graft. For example, a nerve graft is a surgical procedure used to repair damaged nerves by bridging the gap between two healthy nerve ends. Also, study autograft and allograft. Good so far. I think I've covered most of the important vocabulary, and also I've worked on pronunciation of the technical terms. Let's move to the next page. Types of muscles. Cardiac muscle related to heart, skeletal muscle, and smooth muscle. Work on this page, read the whole page. I work on the most important parts for you. Okay, let's go through the text. Types of muscles. Smooth or visceral muscle makes up the walls of the hollow organs such as the stomach, intestines, and uterus, and the walls of ducts such as the blood vessels and bronchioles. Smooth muscle operates involuntarily and is responsible for peristalsis, the wave-like movements that propel materials through the systems. For propel, we can say push as a synonym, and peristalsis, as you could see in the text, is an involuntary wave-like muscle contraction. Cardiac muscle makes up the myocardium of the heart wall. It functions involuntarily and is responsible for the heart's pumping action. Next, you have the skeletal muscle, which is attached to the bones and is responsible for the voluntary movement. It also maintains posture and generates a large proportion of the body heat. All of these voluntary muscles together make up the muscular system, as you can see here. Study the rest of the section here. I want to move to the next page, which is here, box 6.2. This one is important. I've already introduced flexion, which is closing the angle at a joint. Study all of these technical terms. I've talked about abduction, moving away, and adduction, moving toward. Let's work on the word circumduction here. Circumduction. It means the movement of joints in a circular motion. Also work on other vocabulary, technical vocabulary here. Try to work on all the vocabulary related to movement or direction. Pronation means turning downward. Work on the rest. In eversion and inversion, I need to tell you that this E here means outward, and this in means inward. In something inward, and this one here means outward. You also have this E in exit. As to the naming of muscles on page 194, a muscle can be named by its location, for example, near a bone, by the direction of its fibers, the pronunciation is fiber, or by its size, shape, or number of attachment points, for example, heads, as indicated by the suffix seps. It may also be named for its action, adding the suffix or to the root of the action. For example, a muscle that produces flexion at a joint is a flexor. Okay, work on this picture here, and and get to know the different technical terms. On page 196, we have terminology, key terms, work on this section. You have some good words here. For example, you have actin and myosin. Actin is one of the two contractible proteins in muscle cells. And here is the word. The English pronunciation is fascia. The American pronunciation is fascia. Fascia, which is the fibrous sheath of connective tissue that covers a muscle. In the pretest section, we have the words insertion and we have the word origin, opposites. Origin in a given movement, the point where a muscle is attached to a stable part of the skeleton. And we have synergist, a muscle that assists, that helps a prime mover to produce a given movement. The word synergy, I think you should be familiar with this word. Again, means to some extent means assistance or help. On 197, you have a very important table, roots pertaining to muscle. The word myo means muscle, work under rest. Of course, some of them need more attention. For example, here we have in, which is fiber. Here we have erg, which is work, like in ergonomics. And we've already worked on kinesis related to movement. Another important section is 198, clinical aspects of the muscular system. Any disorder of the muscles is described as a myopathy, and I need to work on the pronunciation of this word, creatine kinase. Also work on the technical definitions here. For example, muscular dystrophy, which is in short wasting away of tissue. It refers to a group of hereditary diseases involving progressive non-inflammatory muscular degeneration. And here you also have another good word, polymyositis, which is the inflammation of a skeletal muscle leading to weakness, frequently associated with dysphagia, which is difficulty in swallowing. I've already told you about this, DIS or DYS. They both mean difficulty or having problem. Continue the section, get to fibromyalgia syndrome, which is a difficult to diagnose condition involving the muscles, mainly associated with widespread muscle aches, tenderness, and stiffness. Next, we have chronic fatigue syndrome. The word fatigue means extreme tiredness. Chronic fatigue syndrome involves persistent fatigue of no known cause that may be associated with impaired memory, sore throat, painful lymph nodes, muscle and joint pain, and headaches, sleep problems, and immune disorders. Then you have myasthenia gravis, which is a chronic disease causing weakness of the muscles of the face, arms, and legs. Next, you have amyotrophic lateral sclerosis. Which is a progressive degeneration of motor neurons that leads to a muscle atrophy. Here also read this section, rotator cuff injury, and I need to move to the next page. This section is also important, carpal tunnel syndrome, which is a medical condition of pain and weakness in the hand caused by repeated pressure on a nerve in the wrist section of the hand. On page 201, study trigger finger, which is a painful snapping, triggering, or locking of a finger as it is moved. Study hamstring strain, shin splint, and Achilles tendonitis. This is Achilles tendonitis. Damage to the Achilles tendon hampers or prevents walking and running. We have a good word here, hamper. Hamper basically means to prevent, especially to prevent someone doing something easily. Prevent someone doing something easily. Here we have a good word, elevation. Elevation, which is of course, elevation of a damaged limb or damaged part of the body. The verb of elevation is elevate. To elevate means to raise or lift something up to a higher position. As I said here, especially the elevation of a limb of a body, part of the body. And last but not least, study the terminology, the key terms here on page 201. Okay, that's over. I think this part was useful. If there is you think there is a vocabulary which needs more explanation, comment down below or send me a text message. I will work on it.